ImSelect is mental health data that connects the dots. I'm Dr. Amber Childs, and I am an expert and national leader in evidence-based, data-driven behavioral health, and I'm the founder of ImSelect, which you can't see here. But listen to me, $13.9 billion. That is the total cost to treat mental health problems in children in 2012, making it by far the costliest health condition in youth. And 60% of these costs were being spent on adolescents aged 13 to 17. The CDC data have shown us that in the 10 years before the pandemic, rates of depression and deaths by suicide in our adolescent population had skyrocketed. And on Valentine's Day this year, we found out the effects of the pandemic with the highest reported rates of depression in a decade showing up in our adolescent females. The data could not be clearer. Our youth are in crisis, but the simple fact is most teenagers don't get the evidence-based treatment that they need, and so the crisis and the costs continue to rise. Evidence-based treatments are proven to reduce symptoms while also reducing the costs associated with poor outcomes. And when you add a routine measurement practice, it actually amplifies those benefits. Teenagers need evidence-based treatments that include routine assessments to deliver brief, personalized interventions right where teenagers are most likely to seek out help, which is online. And they need those data to work hard for them, to connect the dots between that teenager to their care provider to their caregiver so that everyone is benefiting from those data-driven clinical insights. And that is exactly what we designed ImSelect to do. Here's how it works. Emma is a 15-year-old. She's going to log her symptoms of depression using a brief standardized assessment. And then ImSelect, using those self-reported data, is going to provide her with targeted feedback and then connects Emma with brief, science-backed, interactive treatments that are customized to her standardized data. And it's going to adjust those treatments and solutions over time according to her routine standardized assessment as well as her engagement with the app. ImSelect is also going to connect the dots back to that pediatrician to provide those data to that provider. And it's also going to give that provider clinical decision-making guidance that is integrated into the electronic health record, making Emma's visit more precise, cost-effective, and efficient. And Emma's mother is also going to receive data-driven clinical insights specific to her daughter's measurement so that she understands best how to support her daughter's wellness through a parent portal. Now, ImSelect gives providers three key benefits. First, electronic integrated healthcare clinical decision-making support gives providers the ability to provide high-quality, efficient care. Second, providers can capture additional revenue through payer reimbursement by dropping billing codes that are made for routine standardized assessment. Now, these billing codes are not a hypothetical exercise. This is not a drill. They are active and available and approved for reimbursement through CMS. I could leave here right now and drop that billing code and be eligible for reimbursement. And then finally, in an increasingly value-based healthcare landscape where reimbursement depends on measurable quality rather than volume, ImSelect sets providers up for that optimal reimbursement. And you don't have to take my word for it, because I have asked providers and they say that ImSelect would allow them to provide an impact beyond medication. It would jumpstart their treatment, and it ensures that data is not going into a black hole or into a treatment vacuum where treatment is happening outside of the purview of the provider. Now, you might be asking yourself, why do we need another digital mental health app? You could probably name 10 off the top of your head that you don't see here on this app right now. And while mental wellness apps do have a place, fractionally few of them include any evidence-based strategies, and even a smaller proportion of those include any evidence-based intervention that has undergone rigorous testing to prove its clinical effectiveness. And then finally, there are a number of measurement feedback systems on the market that promise providers to get the data integration loop that they need to make these impacts. But here's what I know. ImSelect is the only solution that connects the dots to integrated measurement, clinically proven, rigorous, evidence-based treatment, as well as wellness strategies to improve outcomes. So within the first several months of formation back in January, I have secured $150,000 in non-diluted funding, built an initial team, and we are well underway with our initial stages of product development. And we have partnered with a software developer to really think about platforming this on a HIPAA-compliant platform. ImSelect has the team that we need to drive success even in these early stages, and we've partnered with a development team. I'm going to keep going because it messed up in the beginning for me there. Listen, I got to give my full 5 minutes. Now, So here's where we are right now. We have a clear integrated clinical strategy, check, complete. We have content development that we have built that is according to our clinical algorithms that we know work for depression. And now we have identified a HIPAA-compliant software partner, and these Blavatnik funds will really help us to protect the data that we get from patients so that we can go to that next step of validation. So connect the dots with ImSelect. Judges?
Yeah.
You can get your full 3 minutes of questions.
Great presentation, very engaging, very clear. I want to drill into the CPT code you mentioned, because obviously providing a financial ROI to providers is important to adoption, which you've identified. And so I'd love to hear what that CPT code covers, what needs to be done, and a little more color there.
Yeah, absolutely. So if any of you were at the panel yesterday, what did we hear? What we heard from panelists was 1, data is gold. 2, we need to make things seamless for providers. And then 3, we need to really look at the reimbursement pathways to ensure that we're actually able to get this done. So that CPT code is approved by the Center for Medicaid Services for routine standardized assessment. You can capture $5 per every single time that you drop that code. It is actually able to be used currently in primary care for screening. And so if you're having a person taking these assessments once per week, which is what we would do for measurement-based care, so you might have picked up that this is measurement-based care, then a conservative estimate for someone who is working as an individual provider in this practice could capture up to $8,000 per month, even if teenagers are actually only completing 2 out of those 4 assessments per month. So that would be the reimbursement pathway. Now, those E&M codes that you would drop that with, your evaluation and management codes, are already ready in primary care. There's still some work to be done in the behavioral healthcare space, because right now the NCCI won't let you drop those codes more than once and be attached to a psychotherapy CPT code, but the American Psychological Association is actually advocating to have that adjusted, and I sit on that board.
Can you talk a little bit about what is sort of...
Uh-oh, she had a question.
I'm sorry. Go ahead.
So, great presentation.
Thank you.
Very articulate. I second that. How do you think about fostering the engagement on the patient side? Because that's a necessary component for this whole thing to work.
Has anybody ever tried to engage a teenager in something that they didn't want to do? Yeah, I'm really good at that, actually. So what it turns out is if you try to put a suit that's made for an adult on a teenager, not only does it not fit, it's not giving what needs to be gave. If I was a teenager, that's what I would say to you. So what we have to do is we have to use gamification principles to really ensure that teenagers are engaged with this app over time. What we know from the basic science for measurement-based care is that if you give somebody feedback about their data, they are already more likely to be engaged. That's just what the basic literature shows. And if we can design the treatment in a way that is resonant with the youth sensibilities, that is to say, it looks a lot like Instagram and TikTok, but it actually has evidence-based facts behind it, then we're more likely to be able to get teenagers to be engaged. So we also have things like streaks, we've got badges that you can earn, and then these interventions are delivered in these very small doses so that we're able to capture their attention. Happy to hear from you.
It's 2 minutes or 2 seconds. Really.
Sorry, Owen, you'll have to catch me after. Thank you.
Thank you.
Thank you.